Hi, welcome everybody to this month's edition of Ask Nurse Linda. I want to tell you a little bit about Linda. She's been a leader and a provider of rehabilitation nursing for over 30 years and a friend of the Christopher and Dana Reeve Foundation for close to 20. She is a moderator in our Ask a Nurse discussion, which focuses on contributing functional advice, providing the how-to on integrating various healthcare improvements into daily life, and answering your questions. She's in our online community every Wednesday from 8 to 9 p.m. to answer your spinal cord injury and paralysis related healthcare questions. And we have taken her off our community to talk live with all of us once a month. So I will now turn it over to Linda. Hi, Linda.
Well, good afternoon, Julie, and hello, everyone. It's so nice to be back with you again. It seems like the month is so slow to go by until we're back together. Today I thought we would talk about some things that have come up on the blog and the topics that we've been dealing with this last month, one of which is gut ulcers. I call it the other kind of ulcers because people with paralysis are certainly aware of ulcers that appear on their skin, which we call pressure sores. And we're always vigilant and hypervigilant, or at least we should be, about those because your skin needs to maintain its elasticity. So once you have an opening in your skin, you develop a scar. That's the way the body heals itself. That's a natural process. But the scar is not as elastic as the natural skin is. So once you have a pressure sore, you always have a higher risk of having another one come back in that same spot because the skin is taut there now and it's not going to give while you're moving about. But the other ulcer that I'm thinking about are those that appear in the gut, which is part of our GI system. And sometimes people will get an ulcer, and this can happen to anybody. We all know people who get ulcers. Sometimes people call them peptic ulcers if they're in the stomach. Sometimes the ulcer can appear in the higher part of the bowel just right after it goes into the stomach in the large intestine. Those are the two most common places, but you can get ulcers anywhere in the GI system. So you can get an ulcer in your mouth. Sometimes people have those they get a little white sore in their mouth and it's really painful. And it's a little ulcer on the inside, a little erosion on the inside of their mouth. And it can be caused from a variety of things. If you bite the inside of your cheek for some reason, you can create a sore there from your teeth, and then you can get a little bit of erosion in there, creating an ulcer. Those usually heal up mostly on their own. There are some treatments for those if they're occurring frequently, but you have to get to what the root problem of that is. You can get ulcers going down where your food goes all the way down in your esophagus. That moves the food from your mouth down into your stomach. Or you can get ulcers in your stomach or anywhere in your small or large intestine. You can even get ulcers in your rectal area. So they occur anywhere in the gut. The issue for people with spinal cord injury is that what frequently happens is they don't realize they have an ulcer until it's gotten into such a complicated stage. Because if you don't feel the ulcer being there, or if you don't have really an upset stomach or something, giving you a clue that there's a problem, you might not know it's there, and it just keeps going and going until it eventually hits a blood vessel and it perforates, and you could throw up blood, or you could have blood with your stool. And so it's just an important thing to watch because you don't want it to enter the danger zone. You want to be aware that it's there. You want to look for symptoms, which might be just vague symptoms that, I have an upset stomach. I'm not quite sure why. You might want to follow it for a little while, a few days to see. We all get upset stomachs for various reasons. But if your upset stomach doesn't go away, or if you find you're having indigestion, or if you see blood, just even a little bit of blood coming up in vomit or in your stool after your bowel program, sometimes you'll see blood around the outside of the stool, and that's usually indicates hemorrhoids because it's not internal in the stool, but sometimes it's within the stool or just frank bleeding. It can be an ulcer. It can be other kind of problems like a polyp or something. So, taking care of our gut's very important. And people who have spinal cord injury, most frequently ulcers appear within the first 2 weeks of injury. And people think, well, that's a lot to do with the stress because you have a spinal cord injury and you're just finding out you have this, and it's like, oh my gosh. So, and that is an extremely stressful time. And when we're under stress, our stomach acids churn a lot, which can cause some erosions in our stomach or even back up into our esophagus and lead to an ulcer there. So that's the most critical time, but you can get an ulcer anytime. Anybody can get an ulcer anytime. For people with spinal cord injury, sometimes it happens a little more frequently because that sphincter that is at the bottom of your esophagus, where the food goes down your throat and then into your stomach, the sphincter that guards the food from coming back and the stomach acids from coming back up into the esophagus, sometimes that gets weak with spinal cord injury depending on the level of your injury. Sometimes your bowel can become full of stool if it's not moving swiftly enough, or if you're not emptying your bowel and your bladder, sometimes that can push up on your stomach, making little room in your stomach for your food and your gastric juices. So there's all kinds of things that can happen there. And so we're going to talk about that today, and if we have time, we can talk a little bit about use of the computer with disability, but I'm going to not talk about any of those things right this minute because we have a question. And this is from a woman who's writing in about myomalacia. And let's see. She's having some problems with her computer, so I think they're trying to work that out. So what that is myomalacia is when you have some hemorrhages in your spinal cord after spinal cord injury, and it's usually later when it appears, and that's just like this person is writing in. They have had a spinal cord injury about 10 years, and it's at the T5-6 level. And what happens is sometimes that there's some softening of the bone around the spinal cord there, and some hemorrhages within that area. And so the big question is, I think, what can you do about that? And so there, it really depends on exactly what the situation is that is going on with the spinal cord. So if there's some hemorrhages in there, or if you have some bone problems, sometimes people have what they call spinal stenosis. And so the spinal cord and the brain are the same in the body, in the fact that the brain is housed in that in what we call the cranial vault. So it's in the skull, and there's only room for the brain to be in there and the substances that go with the brain. There's no room for anything else. So people who have brain tumors have problems because there's no room for that tumor to be there. If you have bleeding in the brain, that's a problem because there's no room for the excess bleeding to be in there. It only holds what it holds. Well, what people don't often think about is the spinal cord is kind of sort of the same way because it travels down those bony vertebrae, and it's right in the center there. And so that bone is holding that part of the spinal cord rigid. And so there's no room for anything else in there. So the difference with the spinal cord is that the vertebrae are independent with disc in between. So that's why sometimes people get a bulging disc, is because that part of the spinal cord is swelling. The only place for it to go is in the spaces in between the bones because they're hard. They're not going to enlarge. But the excess fluid or whatever you have might go out in between the the vertebrae at the disc. So sometimes people have a spinal stenosis, which is that space where the spinal cord itself runs through the vertebrae is a little bit small. And so if you have some hemorrhages or something in there, which is not unusual because there's still blood supply to the spinal cord and their nerves, and if you have scarring in there, you can see there's extra material in there now. And so there's just no room for that to be put in there. There's just no room for that to happen. And so sometimes what people will do is they'll have surgery for the spinal stenosis, which is making a cut in the bony vertebrae so that it can expand to be a little bit wider. And that helps that blood supply get through that space where it's narrow. And so that's what sometimes people do. That sometimes people might have a smaller space in their vertebrae, but they never even notice it till they just go on with their life. It's not really a problem. It's just the way that they're built. But when you have a spinal cord injury and now all of a sudden you have some scarring in there, or you have some extra blood that's collected in there, that can be a problem just because there's not the use to have that in there. So this person is, if I'm reading all this correctly here, she's concerned about progression and the heat, and we're all having these heat waves right now in the summertime, and it seems like that's kind of zapping her energy. And so probably there's a couple of things that are going on. And one is that the heat and humidity is going to zap people's strength, and that happens to everybody. A lot of times on the news, on the weather now, they talk about the dew point. The dew point's really high. There's a lot of humidity in the air. And that is a collective weather term in that it collects inside our bodies. So even though we're inside a room, I'm inside a room, I have wonderful air conditioning in my room, but when it gets really humid outside, sometimes that air conditioning, it cools the air, but it doesn't take out the humidity necessarily. The effects of humidity builds up in our bodies. So it really zaps all of our energy. That's why people get so cranky when it's humid outside and it's so hot, because it just zaps all our energy. Now, if you have low reserve because you have a spinal cord injury and you're exerting a lot more energy to try to get around wheeling yourself or maybe using crutches or whatever you're trying to do, this accumulates in our body, so it's harder for all of us to get around. And so that's probably what's making you just zapping your resources. And even though you stay in a cool environment, it's still that humidity kind of creeps into our bodies and just kind of stays there. And so the more days of humidity that we have, the more our body accumulates this like humidities within ourselves. So it makes it even more difficult. So, staying in a cool room, cooling down helps, but we still know that this humidity is going to affect us a little bit. Now, that doesn't really have anything to do with this, with the macromalacia, but that is that you have the stenosis in your spinal cord. Usually those will stay pretty stable the way that they are, and I know that your question is about progression, and usually they stay, but it's there, so you want to have that monitored. And maybe just, for most people, they usually monitor it just once a year. Maybe they'll do an X-ray or an MRI or CAT scan to see how that's doing. People who stay stable, you just kind of wait it out and see. A lot of times the body will self-correct, and it'll try to take the excess fluid away. And so a lot of times that happens. If they find that it has advanced in any way, or if suddenly you've lost a significant amount of function, they'll do the test earlier and monitor it. If they're seeing that there's some kind of progression that's going on, they'll do the testing more frequently and monitor that. If it gets so bad that you're losing function or something's happening, then what you would need to do is have some kind of procedure that might help reduce some of that swelling in that particular area. That can be like the surgery to open up the spine a little bit to give it a little more room. It can be other kinds of procedures where they might try to take out some of that extra fluid if it's around the spinal cord but not inside the spinal cord. So there's a variety of things. So you want to keep on top of that and follow that along and make sure that that is staying pretty stable. Or perhaps you could even find that it might be decreasing. So it's something to know about. It's something to be concerned about. But it's not something that if it's stable, it's not like you have to be, worried about that, oh my gosh, something's going to happen overnight. They usually progress pretty slowly. If they do progress quicker, you will notice some change in your function. So that's usually what people will notice, and then they can check back with their healthcare professional, see what other kind of testing needs to be going on for that. And then we have a question, can medications affect ulcers, and what medications are the greatest risk? Well, all medications can cause ulcers, remarkably so. So whenever you take any kind of pill, or even if you swallow medications that they're usually made, if they're liquid, they're usually made so that they aren't caustic to your GI tract. But if you take in a pill and you don't take enough water with it, you let it just lay in your stomach, or maybe it doesn't, how sometimes pills you feel like they're kind of like caught in there somewhere, and you haven't taken enough water to flush it down into your stomach where the gastric juices can break it up. So if that pill's just laying there, it can cause an erosion. Now, most medications, if they're not properly flushed through, can cause some of the erosions, but some have a higher risk of causing that. And one of the worst offenders, one of our worst medication offenders for causing ulcers are the antibiotics. And since people with spinal cord injury often take antibiotics for urinary tract infections, or maybe a skin infection or other kinds of infection, you really want to take that antibiotic and flush it down really well with water. So you want to take it with a good amount of water. What does that mean? Well, a cup maybe of water. To really flush it, to get it down through your esophagus. If you feel like it hasn't gone down all the way, then you need to take a little bit more water to try to get it down there. Some medications that tend to cause erosions in the lining of the esophagus or the stomach will say on the prescription, take with food. And that is because if you have some food in your stomach, the gastric secretions are already working on that food, and the food can kind of act as a coating in your stomach. Sometimes people who have problems with ulcers, they'll take a little bit of milk, and it just has to be a couple swallows, not a lot, before they take the medication. Now, other medications will say do not take with food or fluids because they want that medication to get into your bloodstream quickly, and they don't want it competing with food to get into the bloodstream. So be sure and read the directions on your medications to know. Sometimes they'll put a little sticker right on the medication bottle. But we get these pages and pages and pages of instructions with our medicines. And you look at all this and you think, oh man, I don't want to read all this. It's boring and there's so much of it. Especially if you have multiple medications. You might get like almost a textbook of instructions to go with these medications. But at some point in time, you really want to look and understand each of the medications that you are taking. The medication instruction sheet will tell you what the medicine is. They'll tell you the molecular structure of it. You can kind of breeze through that part. Okay, but the part you really want to pay really close attention to is how to take the medication, because as I said, some will have to be taken with food, some will be taken without food. So you want to know, that's very important. Some medications, such as blood thinners, there are certain foods you cannot eat when you're on some of the blood thinning medications. Some medications you can't eat green leafy vegetables with those, so you have to monitor the amount of salad that you're eating. We think, well, green leafy vegetables, what are, anything with a green leaf on it, and salad is a green leaf. So you have to really monitor that, or it affects how the medication is metabolized. There are some heart medications that you can't take grapefruit with. So if you get a fruit salad, you have to make sure there's no grapefruit in it. Although oftentimes mostly people leave it out because there's so many people on heart medication that can't do that. You wouldn't want to have a glass of grapefruit juice. So especially you should know about all your medications and really study what are the side effects so that you'll know if you get one of those side effects and how to take the medication. Those are important pieces of information that you should know about all your medications. Now, if you're on a medication and you're getting refills and you've already read all that product information, sometimes you might want to refresh your memory about it, but most of the time you can say, oh, well, I've already read that, so I'm good to go. So if you are having some problems with some medication, maybe you want to go back to that information and start looking at your medications. Sometimes you can be on medication for even years, and all of a sudden, we all get older. Our body metabolism changes for one reason or another, and you might be on a medication for years and years, and then all of a sudden one day you develop an allergy to it. You think, what's going on? Well, it's usually something that's happened. We've either changed our diet or we've changed something in our lifestyle, or just all of a sudden years later you can develop an allergy to medications that you've never had before. You might want to go back to that product information and look and see what are the signs of the allergies for that medication so that you'll know about that. There's another interesting question here about medicinal cannabis. And do you have experience with patient using it, and has it helped them with spasticity and nerve pain? Well, there's very straightforward to this question, yes and no. I do have patients that use medicinal cannabis who swear by it. This is the only thing that's ever worked for them. They think it's fabulous. They can't go without it. It's changed their lives. They just think it's wonderful. I have had other patients who've taken it, and it seems to do nothing for them. Now, there's a lot in the news right now about medicinal cannabis because many states are legalizing medical marijuana in their states so that people, some states you can just go in and buy it. Some states you have to have a prescription for it. In any event, in any state, you are capable of getting medical marijuana. In some states they're legalizing it so you can go to like a store and they have different, what do they call it, different varieties of the medical marijuana or the marijuana. So some have kind of a lemon flavoring to them, and some are have different properties about them. And so some people will say, well, this one particular type of marijuana works for me, but this other particular type does not work for me. So, people get very specific about it. So does it work or doesn't it work? Well, it's a chemical that you're putting into your body. The primary effect of marijuana is mellowing of the body. So, you become very mentally mellow. Your body might become, your body becomes mellow, but what does that really feel like? It's less tension. And so people with spasticity and nerve pain feel like maybe that helps relax their body so that they don't have that spasticity and their nerve pain. Does it work better than some of the other medications? I don't really know. Here again, it's kind of a slippery slope. There have been studies done with medical marijuana, but there's not been any evidence that says medical marijuana works better than anything else that you have. Some people do not like the side effects from traditional medications, but there are side effects of medical marijuana also. And some of the side effects of long-term use of cannabis we don't really know about. So it's not been tested to the extent that traditional medications for spasticity has been tested. So what the long-term outcome of using medical marijuana or medical cannabis is, we don't really know about that. So, it's kind of up between you and your healthcare professional. I would not recommend anybody just going out into the street and getting some cannabis and trying it and seeing if that works for their spasticity, because you don't really know what you're buying. Some people put extra substances in there to kind of stretch it. Some people are selling what they say is cannabis, but in fact it's not. Some people, for whatever reason, they put more dangerous drugs in there. There's some synthetic marijuanas that really have a lot of complications that I know those are not controlled, and so you really don't want to get involved with that at all. So the ones that you buy from these legalized drug centers, and it's an ironic thing because even though they're legalized, it's a cash-only business. You have to go with your cash in hand. You cannot use a credit card to buy it. So there are people who really swear by it. By and large, most people will tend to take medication that's been tested and tried specifically for their particular diagnosis. If you go to one of these legalized shops, it's regulated so that you're more apt to be buying medical marijuana in one of those shops than you would be if you were seeking it out on the street. So has it helped people? I would say it has helped some people, and some people, just really swear by it. I don't know if it's really helping their spasticity and nerve pain, or just mentally they're so enamored with the thought that they're taking the marijuana that it helps them. We have lots of incidental stories on the news. We have people who are using medical marijuana for a variety of things, spasticity being one of the big issues with neurological nerve pain. But there again, we don't really know all the effects on that, and we don't know the long-term effects on that. So you really want to discuss with your healthcare professional what all your particular healthcare issues are before embarking on a trial of that. Sometimes people have tried so many things, they're kind of, I don't know what else to do, and so they'll turn to that, and sometimes they think it helps them and sometimes they think it doesn't. When you're taking the medical marijuana, you're not really taking what we in the healthcare professions think of as a traditional dose. So how much you're taking, it's usually inhaled. Some people will put it in food. Some people will put it in capsule form. And so you really don't know what's in that and how much of it you're getting. So if you're smoking it, which is the most common way people ingest it, you have to think also you're smoking it. Well, does 2 puffs, is that enough? Do you need 12 joints of marijuana to achieve the effect? Do you need to do it every hour, or can you do it once a day? So the dosing is really unclear. So sometimes I think people really overdose themselves on the marijuana, and then they're so mellow, well, nothing seems to bother them. So they couldn't really say, is it affecting your spasticity, but just nothing is bothering them. So it's a slippery slope. You also have to think whenever you're inhaling something, and if it's marijuana or if it's a cigarette, or even if it's one of these e-cigarettes, you're inhaling substances into your lungs, so you're greatly increasing your risk of lung cancer. Anybody can get lung cancer. We don't know why some people get it, some people don't. Some people never smoke and they still end up with lung cancer. You also need to think about the other cancers. People who ingest any kind of smoke or ingest things into their lungs can end up with bladder cancer. Lung cancer is number one. Bladder cancer is number two. So if you are at risk for bladder cancer in that you're catheterizing yourself, that puts you at a higher risk, and then you're also doing the medical marijuana, you could be setting yourself up for quite a bit of trouble. So there's just a lot of things to think about that we're just not clear, and we just don't have enough information about it. Now maybe someday it'll be like, gosh, why weren't we all doing this years ago because it's so wonderful? But we don't have that answer right now. So we need to think about that sort of thing. So getting back to the question about the ulcers and if my medication puts me at risk, should I have special labs on a regular basis? Not necessarily, and the reason for that is because if you're taking your medications according to the instructions, and if you're flushing the medications through your mouth and your esophagus into your stomach, you should not really have any problems with that. People who have spinal cord injury, sometimes they're not taking in as much water as they need to be, especially if they just are taking their pills. But you know, I see people all the time take pills and they just pop them in their mouth and they swallow. I think people sometimes don't think about the technique of taking a pill. You really need to flush that pill through their system. But you know, you'll see people at work, oh, I have a headache, and they'll take a couple of aspirin or Tylenol. They'll pop them in their mouth, and then they just swallow. They don't take them with water at all. So I think as long as you are taking your medications with a good flush of water, you should be okay. So, you know, stomach ulcers or GI ulcers can come to any of us for any particular reason. So that would be an opportunity for you to just take some water and then follow that along. Now, getting back to our lady who has the problem with her spine, and she's looking for some research or some advice to reduce the pain and weakness. So probably the best thing to do would be to check with your healthcare professional and see what other kinds of opportunities are available. This woman is saying that she's told there's no viable treatment, but yet there are some treatments. Maybe in your particular case, if it's from blood vessels, maybe there is no, you know, it depends on what the cause is for that spinal stenosis. If there's a lot of blood vessels, maybe there's no way to get in there and get those, but you can always open the vertebrae just by making a little slit in that, making that area a little bit larger. So there's something more going on with that. So if your physician is saying, well, I'm sorry that, you know, there's nothing that we can do, and that's just the way it is, you have two options. You can accept that, or you can get a second opinion, and that's probably what you need to do, because you know, it could be that there might be something, but maybe it's just not the right course of action for your particular case. Or sometimes people don't, you go to a healthcare professional, you know, there are a lot of people who have a spinal cord injury, but in one particular medical practice, one person may not see a lot of people. You know, you may be the only person in that practice with a spinal cord injury. That is not unusual for people that are living in different parts of our country. If you live near a major medical center, you're probably going to be seen by a physician or a healthcare provider who has other people with spinal cord injury in their practice. Here in St. Louis, we have 3 major medical centers that all are expert in treating spinal cord injury. So in the small little bit of area, we're landlocked by the rivers. So in the small little bit of area, we have 3 major medical centers that have excellent spinal cord injury centers. Very unusual for many places, but we're lucky that way. So a lot of people in this area have access to great spinal cord injury care. But if you're in, even if you go 100 miles away from St. Louis, you can be in a community where you're the only person who has a spinal cord injury. So sometimes you're seeing a neurologist, maybe they saw somebody with a spinal cord injury in medical school, but they really don't have anybody with a particular case like yours. So it's a good idea to talk to a specialist. If you've seen a general practitioner, talk to a neurologist specialist. I would start with the neurologist. If you start with a neurosurgeon, neurosurgeons do surgery, so they're always going to come up with a surgical solution. If you go to a neurologist that treats problems medically, that would probably be your best start for a second opinion. Now, it could be that maybe, in fact, sometimes this is the way it is, and there is nothing to be done about it, that the science hasn't met up with it. We know that people who have spinal cord injury, we know that there are a lot of treatments, but we do know that there's no surgery or medication that's instantly going to make that condition just go away. So be sure to, if you're not satisfied ever with what you're being told, or you want to know if there's more, or if there's some place where you can go and get more help, be sure and get a second opinion, because it could be that there's something for you out there, but you just haven't tapped into the right resource quite yet. So reducing the pain, again, pain control is a huge problem for people with neurological injury, and especially those with spinal cord injury, and weakness, which is part of the complications of the spinal cord injury itself. And so it could be maybe not the problem is being that particular diagnosis, but just a result of what's happening in the evolution of the disease. So there's a lot of neurological issues that people haven't quite found a cure for, but they're certainly working on those things. But if you are having an abundant amount of pain and nothing seems to be helping, be sure and see a pain specialist, or tell your care provider that you're seeing, because there's an abundance of pain medications out there. There's different pain procedures. You can always work up the ladder. So most people start out in treatment of pain. They'll take an oral medication, and then they'll work up the ladder, and they'll try maybe some injections to reduce the pain, and then they'll kind of work up the therapeutic ladder and maybe eventually get to some kind of implant or pump that will bathe the spinal cord, so you don't have the medication going throughout your body. And it'll bathe the spinal cord just to help reduce that pain. And then maybe they'll go on and try some other different techniques after that. So there's a variety of things. I think people feel guilty, or maybe they're a little embarrassed to keep going back to the doctor and keep saying, but this isn't working. And don't be, because sometimes it takes a long time to really figure out what is the key for you. What works for you might not work for somebody else. So, no two cases are ever alike. So just keep pursuing that and keep going with that. And if you need to, find a second opinion so that you can get the treatment that you need. Okay, so back to our person who's looking for the medical cannabis. And so his purpose of taking that is to get off the baclofen, the gabapentin, getting into the topic of the pain. Sometimes it's combinations of all of these things before. And so this person is taking baclofen and gabapentin, etc. So I would imagine they're taking all of these medications, which causes so much drowsiness, and his body can't overcome the drowsiness. And oh yes, that is so frequent. The issue with all these medications is that each one of them causes drowsiness on its own. But after a while, and by a while I mean like 10 days to a couple of weeks, people kind of get over that drowsiness. Now, when you're taking multiple medications that cause drowsiness, it's more difficult to get over that. And so the question would be is, can you back off some of those medications? And you're on the medications for specifically for spasticity and for pain. The gabapentins are the only medications that actually treat nerve pain. A lot of times people have pain, they have a spinal cord injury, they have nerve pain, and so they're given narcotics or opioids to treat the pain. But this is nerve pain. It's a different kind of pain, and those drugs will not really help the nerve pain. Some people take them, they find them useful, and that's great, and they get by just great with them, but usually you need one of the gabapentins, which is Neurontin or Lyrica, to deal with the nerve pain. So the body will adjust to that after a while. Now, if you're a particularly thin person or you're a small person, you need lower doses of those drugs. So this person's having so much drowsiness. So the options would be that I can think of just sitting here. So the options would be, if you're having that much drowsiness and you've been on those medications for a while, you could try backing off some of them. So sometimes, people have pain, they go to the doctor, I'm having pain, we'll up your dose, we'll up your dose. The reason why they keep having to up the dose of the baclofen and the gabapentin is that both of them, people become tolerant of those, and so they kind of lose their effectiveness. So you have to keep going up on the doses. But this person's having some problems with the drowsiness. So if you're still having problems with the drowsiness, and some people do have more difficulty getting over that. So the issue would be maybe to go to the next level of pain control. And instead of taking the medications orally, because then the medication's going throughout your body, and so that's what makes you drowsy. So the next thing would be to talk to your healthcare professional about maybe trying a baclofen pump. And that's an implant that's put in where the baclofen is delivered to the area around the spinal cord itself. So the baclofen bathes the spinal cord itself in the drug, but the drug only goes to that particular area of your body. It doesn't go throughout your whole body system. And so that's usually what is done. Now again, I don't know your individual case. So I don't know if you've tried this or not. Before you have a baclofen pump, it's a device that's actually, it looks kind of like a cardiac pacemaker. It's made out of the same kind of materials. It's a little metal device that's put in, it's about the size of a credit card. It's put in your abdomen, and then a little tube is threaded around and inserted into this area around where your spinal cord itself is. And that's how the medication, the pump has to be filled periodically, and they just make a little injection through the skin, and they refill the pump to keep it filled with medication. But that keeps the medication from traveling throughout your whole body. And people actually can take more medication, but they don't have the drowsiness. Now, if you switch to the medical cannabis, you're going to find that that makes you drowsy also. And if you have that sensitivity to drowsiness, you're probably going to feel drowsy with that too. It'll feel a little different, but you're still going to have some of those issues. The other drugs can be put in the baclofen pump, so if you need a combination of drugs, that can be accommodated for you. And the other thing is that you can have a test before they do the surgery, so you think, gosh, that's a big decision. Do I want this baclofen pump put in? Will it work? Will it not work? Well, they'll do a test, and they try the baclofen. They'll do a spinal injection, and they try it, and to see if you get any relief. And it's kind of, it's a good thing, but I always kind of feel badly for patients, because usually when they get to the stage where they're considering a baclofen pump, and they have just this test, it just works like for the morning or even for just a day maybe. And they have this spinal injection and they get the relief, and then they say, well, my gosh, this is such a night and day difference. I really want this. But then they have to wait for the surgery. So they're back on their medication and they're, have to wait a period of time until their surgery can be scheduled. I just kind of wish that if it worked, it could just be done right that minute so people didn't have to go back, because if it's successful, it's so pleasant for people, it's really hard for them to try to wait for that surgery to occur. So let's see, what else is going on? So the heat, this lady's really having some pain, and she was stable for 10 years. She is in a remote area. Oh, she had a syndromyellia, which was halted. And she says that she's had several friends who've done well with different forms of cannabis, but it's not covered by insurance or Medicare. No, it sure isn't. Yes, they do have food. You can buy brownies with it, and they have candy also that can be made. But there again, you don't really know what the dosing is. Now they can say, I put in so many grams or so many grains of the cannabis. And the cannabis is in these legalized facilities is raised in they're raised in controlled environments. So they're trying to get the same amount of the, I'm going to call it medication, but it's not. They're trying to get the same amount. If you take a leaf of cannabis and you say grind it up or make it, into shreds, into some form that can be taken. Okay, so they're trying to figure out ways to make sure that there's equal amounts in each measured amount of cannabis that's given. Right now there's not. So if you take one leaf of cannabis, there might be a certain amount of it marijuana in that leaf. If you have another leaf, it might be different amounts. That's why they're doing these controlled grows. That's why if you buy off the street and somebody's growing it in their basement or out in their farm or whatever, it could be different amounts depending on how much rain there was, how fertile the soil was, how much humidity there was that day. All these things affect living, growing things. So it affects marijuana just the same way as the marijuana growth, just the same way as it affects our body growth. So it'd be a great idea for you to check that, get a second opinion, and see if you've had a syringomyelia, and that is like a cyst in the middle of the spinal cord, and it usually comes later in the progression of the disease, of spinal cord injury. It's not a disease, but it usually comes later. And people will notice this because they'll have decreased function, and that's how they notice it. Now, there are things that you can do for syringomyelia, and please notice that it's not a common thing. If you have a spinal cord injury, it does not mean you're going to have this. It's really kind of rare, actually, but people do get this, and sometimes they have to go in and drain the cyst. But since it's in the middle of the spinal cord, you have to go in surgically and with a needle to get there. So if you're going in with a needle or you're getting into the center of that spinal cord, you have to create some damage to get there. So it's a very serious surgery. It's a very delicate surgery. It's different, but that makes sense to what this reader's writing about if they had syringomyelia. And then what's happening is the body has tried to repair that, or if they've had something to correct the syringomyelia and to drain it in some way, sometimes it causes some more injury, which creates this abnormal growth of vessels around that area. And that's what causes that to happen. Oh, now here's an interesting comment from one of our fellow Christopher Reeve staffers here, and it says that some states allow the medical marijuana, but it is not protected at the federal level for employment. And this is so interesting. States are allowing this to happen. They're allowing places to sell medical marijuana. So in Illinois, which is just not even a half an hour's drive for me, I could drive to Illinois and I could get medical marijuana legally in that state. If I come over to Missouri, it is not yet legal, so it's illegal in the state in which I live. So it gets very complicated. This is one of those societal concerns of which that we're probably never going to have any federal regulation. There are certain society problems that the states are regulating on their own, but there's no federal regulation. I'm going to bring up this example, and I kind of hate to use this example because it opens another can of worms, but abortion is an example of this. In vitro fertilization, a lot of people are having their babies. They have difficulty having children, and so they're becoming pregnant using in vitro fertilization. There is no federal regulation for either of these activities, nor is there for medical marijuana. But there are state regulations. So if you have in vitro fertilization in Illinois, there's one set of rules. If you have in vitro fertilization in Missouri, there's another set of rules. So a lot of people come to these big major medical centers because over in Illinois it's more rural farming communities, a big part of the American breadbasket over there. And so people will cross the river and come to the major medical centers here, but they live in Illinois. So the treatments are slightly different. The outcomes are still going to be the same, but the regulations and the things that people have to do. So also if you are employed by the federal government and you are a participant in taking the regulated marijuana in your state, you could lose your federal employment because it's not allowed. You're not allowed to be taking those drugs at the federal level. So all of this can get very, very complicated. Let's see. What other kinds of stuff do we have here? Okay, so Jonathan, who's interested in the medical marijuana, is right in the middle. He's sitting right in the middle of this. So his physiatrist has written a prescription for it. However, the group she works for has not yet approved it. See, this is the same kind of thing. I know you're not looking for a high as people have, but if you're taking marijuana, you're going to get a high. So, it just comes with it. That's the way it is. Now, some people who ingest it differently, I'm reading this. It's kind of funny. So this is former police officer, now a licensed pastor. Oh my gosh, yeah, it's not in your purview. But yet, here you are, you've tried all this stuff, and so now you're thinking, well, okay, I'll try this. Some people will take it in food, but still one of the side effects is that you're going to have the high with it, which is the downside of it. So, oh gosh, I hope it works for you. I hope it's the answer. But anything that we take, if it's a medication, if it is if it's a drink, if it's food we eat, everything we ingest in our body has consequences. It has benefits and it has consequences. So if we eat a brownie, it tastes real good. We might enjoy the satisfaction we get from it, but the consequence is it's going to add extra calories to our diet that we might not be seeking. Some people might be seeking those extra calories. Maybe they're trying to build up their weight or metabolism in some way. But everything we have, if it's a medication or the food we take, the things we drink, everything is going to have consequences. So these are things that we have to think about with medications, such as if we take medications in, are they going to affect our gut? Are we going to develop a stomach ulcer? How is anything going to work? So the other thing that I wrote, I know our time is up here, so I'll quickly wrap up. But another thing that I wrote about this month was use of the computer, and I had somebody who had written in was having some symptoms of autonomic dysreflexia. And it was very interesting because you could tell that this poor guy was at the end of his rope because he couldn't understand, and I don't think he could get anyone else to understand how when he would use his computer he would have the symptom of autonomic dysreflexia, the symptom being a runny nose. Now there are several symptoms of autonomic dysreflexia. People first of all think of the severe headache. There's flushing, there's sweating, there's clamminess, but runny nose is one of the symptoms. And to have autonomic dysreflexia, you don't have to have all the symptoms. You can have just one, and it could be one of the less frequently seen symptoms. So I think what was happening for this guy, and I don't think anybody was listening to him because people would be like, what? This doesn't seem right. But I think it was clear to me what was happening was he was using his computer and he was getting this runny nose. And so computers have been linked with different kinds of things because we're looking at them so intently with our eyes, which is part of our neurological system, and the information is going in through the optic nerve. And computer screens, we don't realize, even though they look like they're consistently being the same light intensity, sometimes they have variations as power surges and ebbs. Sometimes there can be a little bit of difference in the light intensity, and we don't even notice it because we're so busy. It's so subtle. The other thing is that we can have a cursor on our screen that's flickering, and that can trigger some neurological symptoms. Just the intensity of maintaining our gaze at one place for a long time. People have heard about seizures coming from people who are listening to television programs, and the tone or the pitch of someone's voice will trigger a seizure in certain people. This can happen with the computer, but maybe it's not a seizure that's triggered, but it's autonomic dysreflexia. We know that the light from the computer screen certainly disturbs sleep function. If people are playing the computer too soon before they go to bed at night, they have difficulty falling asleep. Or if you wake up at night and you think, oh, I'm going to check my phone and see if I have any email. I woke up in the middle of the night and I can't get back to sleep, so I'm going to check my email. The last thing you want to do is turn on your TV or check any of your devices, because the light emitted from the screen mimics daylight, and so that tends to wake our brain up even more, making it even more difficult to go back to sleep. So the computer has a lot of neurological effects that we don't even know about, and we're just starting to learn about these things. So on that note, we certainly have covered a wide range of topics, and so I hope that I've answered pretty much mostly everybody's question here. And you'll have to keep up with us and let us know how you two turn out with your pain problem, and pain problem, and the spasticity problem with the marijuana. We'll have to see how that works for you two, and what you decide to do about those two problems. If at any time anybody would like to write into the blog, please do. We'll be happy to answer you. I try to answer as soon as possible. I am on the blog on Wednesday evenings, so you can count on me being there then. But feel free to write in any time, and I'll try to get an answer to you back as soon as possible. So I get great ideas. I was very happy when that person wrote in about using their computer and the problems that they were having, because it triggered a whole blog idea from that. So the problem that you might be having might be the problem that somebody else is having. So be sure to feel free to write in, and we'll be in contact again. So thank you for listening.
I want to thank everybody for joining us today, and to remind you to join our online community at christopherreeve.org/nurse, where you can leave questions for Linda and she will answer them there. And also be on the lookout for our next online discussion with Nurse Linda at the end of July. So thank you, Linda. Thanks for everyone.
Thank you. Have a great day. Bye.
Julie?